Multiple sclerosis. Introduction. Multiple sclerosis, MS, is a chronic, autoimmune, and neurodegenerative disorder affecting the central nervous system, CNS, including the brain and spinal cord. It is characterized by demyelination, inflammation, and axonal damage, leading to progressive neurological impairment. MS manifests with a variety of symptoms such as muscle weakness, vision disturbances, cognitive dysfunction, and impaired coordination. The condition can significantly impact the quality of life, necessitating early diagnosis and appropriate management. Definitions. According to National Multiple Sclerosis Society, NMSS, multiple sclerosis is an immune-mediated disease in which the body's immune system mistakenly attacks myelin, the protective covering of nerves in the CNS, resulting in nerve signal disruption. According to World Health Organization, WHO, a chronic inflammatory disease of the CNS characterized by multiple plagues of demyelination and variable degrees of axonal loss. Multiple plagues of demyelination refers to the formation of lesions, plagues, in the CNS where myelin, the protective covering of nerve fibers, has been destroyed. This demyelination disrupts the transmission of nerve signals, leading to symptoms such as weakness, sensory loss, and coordination problems. Variable degrees of axonal loss means that, along with myelin destruction, the underlying nerve fibers, axons, can also be damaged or lost to different extents. This axonal loss contributes to long-term disability in MS patients. Risk factors. Genetic factors. Family history of MS increases susceptibility. Presence of certain genes, such as HLA-DRB1, linked to increased risk. Environmental factors. Vitamin D deficiency, low vitamin D levels associated with higher MS risk. Viral infections, Epstein-Barr virus, EBV, is a potential trigger. Smoking, linked to increased MS severity and progression. Geographic location, more common in temperate climates, suggesting a role of sunlight exposure. Etiology. Autoimmune response. In multiple sclerosis, the immune system mistakenly targets the myelin sheath, which is the protective covering of nerve fibers in the central nervous system, CNS. This attack results in inflammation and demyelination, disrupting the transmission of nerve signals between the brain and the body. Over time, this damage leads to progressive neurological impairment. Genetic predisposition. Individuals with a family history of MS or specific genetic markers, such as HLA-DRB1, are more likely to develop the disease. Although MS is not directly inherited, having a close relative with the condition increases susceptibility. Researchers believe that genetic factors influence the immune system's abnormal response, making some people more prone to developing MS. Environmental triggers. Certain environmental factors, such as viral infections, example Epstein-Barr virus, vitamin D deficiency, smoking, and geographic location, may contribute to the development of MS. These factors can influence immune system activity, potentially triggering the onset of the disease in genetically susceptible individuals. Studies suggest that inadequate sunlight exposure and low vitamin D levels play a crucial role in MS risk, as vitamin D helps regulate immune function. Types of multiple sclerosis. Relapsing remitting MS, RRMS. This is the most common form, affecting about 85% of MS patients. It is characterized by periods of relapse, where symptoms worsen or new symptoms appear, followed by periods of remission, where symptoms partially or completely improve. These relapses can be unpredictable and vary in severity and duration. Secondary progressive MS, SPMS. Initially, individuals with SPMS experience RRMS, but over time, the disease transitions into a more steadily progressive phase. This means that neurological function worsens gradually without distinct relapses or remissions. While occasional flare-ups can still occur, the primary characteristic of SPMS is a continuous decline in physical and cognitive abilities. Primary progressive MS, PPMS. Unlike RRMS, PPMS is marked by a steady worsening of symptoms from the onset, without relapses or remissions. It accounts for about 10 to 15% of MS cases and is often associated with greater disability early on. Individuals with PPMS may experience a gradual decline in mobility and neurological function, with fewer treatment options available compared to RRMS. Progressive relapsing MS, PRMS. This is the rarest form of MS, involving a continuous progression of the disease along with occasional acute relapses. Unlike RRMS, there are no periods of full remission, and symptoms steadily worsen over time. Due to its aggressive nature, PRMS often leads to significant disability at a faster rate than other forms of MS. Pathophysiology. Immune system dysfunction. T cells and B cells attack myelin. Down arrow. Demyelination. Loss of protective myelin sheath. Down arrow. Axonal damage. Nerve fiber injury and degeneration. Down arrow. Plaque formation. Sclerosis in CNS leading to signal transmission issues. Down arrow. Neurological impairment. Motor, sensory, and cognitive dysfunction. Clinical manifestations. Muscle weakness and spasticity. Vision disturbances, optic neuritis, blurred vision. Fatigue and cognitive impairment. Sensory changes, numbness, tingling. Loss of coordination and balance issues. Bladder and bowel dysfunction. Emotional disturbances, depression, anxiety. Diagnostic evaluation. History taking and neurological examination, assess symptoms and rule out other conditions. Magnetic resonance imaging, MRI detects CNS lesions and plagues. Lumbar puncture, CSF analysis identifies oligoclonal bands indicating CNS inflammation. Evoked potentials, tests nerve function and signal transmission efficiency. Blood tests, helps exclude other diseases mimicking MS. Medical management. Disease-modifying therapies, DMTs reduce relapse frequency and delay progression, example interferon beta, natalizumab, fingolimod. Corticosteroids, used for acute relapses to reduce inflammation, example methylprednisolone. Immunosuppressants, modulate immune response, example azathioprine, rituximab. Symptomatic treatments, muscle relaxants, pain management, antidepressants. Surgical management. Deep brain stimulation, DBS helps with tremors and spasticity. Baclofen pump therapy, delivers medication directly to the spinal cord to manage spasticity. Dietary management. Anti-inflammatory diet rich in omega-3 fatty acids. Vitamin D and B12 supplementation. Hydration and fiber intake to manage bowel dysfunction. Nursing management. Nursing diagnosis, fatigue related to impaired nerve conduction. Interventions. Encourage energy conservation techniques. Administer prescribed medications. Educate on physical therapy and lifestyle modifications. Nursing diagnosis, risk for falls due to muscle weakness. Interventions. Assist with mobility aids. Implement safety measures in the home environment. Encourage balance exercises. Nursing diagnosis, impaired urinary elimination related to bladder dysfunction. Interventions. Monitor fluid intake and schedule voiding. Educate on self-catheterization if necessary. Administer prescribed anticholinergic medications. Prevention. Maintaining adequate vitamin D levels. Avoiding smoking and environmental toxins. Engaging in regular physical activity. Managing stress through relaxation techniques. Complications. Permanent disability and loss of mobility. Severe cognitive impairment. Increased risk of infections, due to immune suppression. Depression and social isolation. Conclusion. Multiple sclerosis is a chronic, progressive neurological disease with a variable course. Early diagnosis and intervention with disease-modifying treatments, symptomatic management, and rehabilitative care can help improve quality of life. A multidisciplinary approach involving neurologists, physical therapists, psychologists, and nursing care is essential for effective management and patient well-being.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.